Two huge health headlines to tell you about this morning, both dealing with RFK Jr.'s MAHA movement. On Wednesday, the FDA held a meeting surrounding whether fluoride tablets that are usually prescribed to kids, whether those are helpful or harmful. Meanwhile, the Department of Health and Human Services announced that it will officially remove a mercury-based preservative from flu shots distributed here in the United States. Joining me now is physician and senior public health contributor for Forbes, Dr. Omer Awan. Doctor, always good to have you. You know, I think people hear this headline and most people hear mercury and flu shots. Like, why would that ever have been there in the first place? But I might add, there's no scientific evidence that this preservative is harmful toward humans. So break that down for us. Is this move necessary? And if so, why has it taken this long to see change?
Absolutely, Markie. Well, first of all, thimerosal is a mercury-based derivative that has traditionally been used in some flu shot formulations to prevent contamination from, bacteria and fungi in multi-dose vials. And it actually only exists in a very small percentage of shots. So for flu shots, it only exists in 4% of flu shots. And as you stated, the research has shown that thimerosal, or this mercury-based derivative, does not cause harm to humans. And in fact, the FDA has even said multiple times in many statements that there is no harm from thimerosal. So, taking this out really doesn't make vaccines more safer or more effective, because we already know that they are safe and effective with thimerosal. But what I fear is that taking this out may undermine confidence in vaccines and cause people to be more hesitant to get vaccines, because it casts doubt in vaccines. And I think this is what's precisely happening around the country.
And I was going to ask you that because some critics coming out after this move in particular are worried that removing that ingredient from flu shots could lead to fewer people getting the shot. Is that because of skepticism, or would this mean fewer shots would be available to people? How are we supposed to read that?
I think skepticism, Markie, because what this does is that this casts doubt. Well, why is this being investigated? Why is it that mercury is in vaccines to begin with? I think this starts a public discourse where people start to question things, and this vaccine hesitancy has already been a major problem in America. Even when you look at measles, for example, the vaccination rates have declined, and this is what's fueling outbreaks throughout America. And this is why people, 2 children have died because of measles, when we know that measles is an entirely preventable disease if given vaccines. So very important for people to understand that vaccines are still safe and effective, and this is a major public health breakthrough that has saved countless lives throughout decades and years.
Let me ask you about fluoride, since I mentioned it off the top too. Secretary Kennedy has also been adamant about eliminating fluoride from water, prompting questions about its safety to ingest. Utah was the first state to ban it from public drinking water, and now the FDA is considering banning those fluoride tablets often prescribed to kids who don't have access to fluoridated water. Good idea? Bad idea? Does this mean an onslaught of cavities?
I think it's a bad idea, Markie, particularly because fluoride is so critical in preventing cavities and tooth decay. The American Dental Association has stated that fluoride decreases cavities and tooth decay in both children and adults by 25%. I mean, that's a big number. And fluoride in the concentration that exists in fluoridated water is less than 0.7 milligrams per liter. And all studies have shown at that concentration, it's very safe and effective, and it does not harm individuals. Now, certainly at higher concentrations, there can be some harm. It can result in tooth discoloration. It can result in bony deformities, but that's at concentrations much higher than is recommended by the U.S. government currently. So fluoride is very important in preventing cavities and tooth decay.
Yeah, just about 30 seconds left, Doctor. One more question for you. The MAHA movement has pushed for changes, big changes and big changes rather quickly. Everything from dyes to these vaccines to fluoride. Overall, do you like the path that they're on, or do you think that they're missing the mark with bigger fish to fry out there?
I believe they're missing the mark. I think some things are beneficial, like artificial food dyes, no doubt. I'm so happy and thrilled that they're going after that. But the bottom line is that we're missing some of these more grandiose public health problems, things like, vaccination rates, as you stated, fluoridation in water, even, this cane sugar in Coca-Cola. It doesn't address, added sugars, which is a huge driver for obesity, type 2 diabetes, and heart disease. So these are bigger problems that I believe we need to tackle going forward.
Well, we'll see what they decide to tackle. Up next, Dr. Omer Awan, thank you so much. Appreciate your time, sir.
My pleasure. Thank you for having me.